switch to Dewan. And
Good afternoon. If anyone's watching this and you can't hear me, if you could text us, we just want to make sure that our both video and audio is working. And if we don't hear anything in a second, then we'll presume that we're good to go. I don't think I'm on there for. Okay.
I think we're good.
All right, so we're going to get started with our presentation today. If you hear a little catch in my voice, I have been on more conference calls in the last few weeks and have talked clearly too much. So bear with me if I sound a little scratchy, I'm okay. All right, so I wanted to first show you, we're kind of getting in the habit of showing you where we were versus where we're now in terms of COVID. So about a week ago, we had about 454,000 worldwide cases and 20,000 deaths. And as of a few minutes before I came up today, we're now actually almost 1 million. The press is reporting that we've exceeded 1 million on the website from Johns Hopkins. It's actually about 998,000 right now, and over 50,000 deaths in the world. In the U.S., 234,000 and 5,316 deaths. We are seeing an increase in the United States. In California, you can see on this slide that we now have 8,155 cases. I think we were about 2,000 cases about a week ago. And this slide gives you a breakdown. Much like the rest of the world, we're seeing slightly more men than women who have been diagnosed with COVID. And typical with the rest of the world, a smaller number in the 0 to 17 and a larger number 18 to 65 plus. Some new data that the California Department of Public Health is reporting out shows that in terms of confirmed cases, about 1,855 of those, or about 25%, a little less than 25%, are hospitalized, with 774 in the ICU, and about 3,000 hospitalized with suspected. So those are people who either have not been tested or they're awaiting the test results, and about 642 are in the ICU. And about 171 fatalities. This is as of yesterday, and the numbers were from 2 days before, so the actual numbers will be higher. And then the map on the right shows you which counties in California have community spread, and we expect soon to see all California counties likely have community spread. In Fresno County, as of late yesterday, we had 82 confirmed cases. 14 of those are from community spread, and there are 37 under investigation. In Fresno County, we have not had any deaths. There have been 2 confirmed COVID deaths in Tulare County and 1 in Madera from a regional perspective. So we continue as a county through the Department of Public Health to have a disaster response that's coordinated with the CDC and the State Department of Public Health. They are continuing to monitor individuals who test positive and ensure that some what we call tracing is done to isolate as many people as possible who might have come into contact. What I will tell you again, and this is, I know, hard to hear, is that we anticipate seeing more cases in Fresno. This is why we are doing the shelter at home, the stay at home orders. This is why we are highly encouraging the social distancing, the hand washing, the elimination of touching your face. All of those are designed to prevent further spread, but we expect these numbers to go up, and we all need to condition ourselves that we are going to see more cases. If you practice those measures, your chance is less of being exposed to COVID at this time. And remember, what we're trying to do is what they call flatten the curve, and that is simply slow down the pace of spread. It is quite likely that the vast majority of us eventually will be exposed to COVID, but in terms of that pace of exposure, these measures are designed to decrease that, and that's why they're so important. Last week we talked about the fairground being looked at for a potential field hospital or alternative care site. You may have seen in the news that that is out of consideration. Today they're looking at the convention center as a possible site, but stay tuned on that one. So what are we doing? Well, an awful lot. We are finalizing and think we have good plans in place to ensure that all of our at-home staff has the proper equipment to do their job, and that is with our desire to continue to provide remote services to the people we serve wherever possible, understanding that we will still be providing some on-site services to clients. We have updated the daily health screening to be more remote. So those of you who work in the department and to our contracted providers who are also on the call, we've given you access to fillable PDF forms to do that. We're recommending that people do that via the phone to limit contact as much as possible. And you should be prepared that if you're exhibiting any of those symptoms, we do not want you at work, and we highly advise you to stay home and isolate yourself. And let your medical provider know if your symptoms worsen. We are likely at some point going to have a more streamlined way of doing that. And as that happens, I would ask you to be patient with us. I know there's a lot of new protocols and a lot of changing protocols. And unfortunately, you're going to have to get used to that right now. Particularly from a public health perspective, things change as more information becomes available. Recommendations change. Measures that public health recommends we do are heightened as more cases occur and such. So the best that we can all do is to follow those recommendations and to take care of ourselves and our family to be as safe as possible right now. We will likely look to adding our daily screenings at some point to include our staff who are working from home and our telehealth clients. Not right now, so you don't need to do that right now, but we likely will add that eventually so that we have a better public health surveillance of the spread of COVID-19. And when we decide to go in that direction, you will get very specific guidance from our department on how to carry that out. So I'm telling you this to prepare you and set your expectations, but not expecting that you will implement that now. We are continuing with only essential personnel coming to work, and essential in our definition is not valued because you're all valued, but essential in terms of the work that needs to get done can only be done from the office. We will occasionally be bringing people in for various and assorted reasons, and so if you are asked to return to work, please work with us in ensuring that that can happen in the safest way possible and be in close communication with your supervisor. Remember, if you are working from home, we need you to be in close contact with your supervisor and be available for work assignments as they are given. Our warm line is now operational 5 days a week. And we also were operational over the Cesar Chavez holiday. We're getting a steady amount of calls right now, not a volume that we can't handle. I have begun to get some requests from the community or interest in the community for volunteering for different things like the warm line. And if you'll let me know what your availability will be as that need is created, we would appreciate that support. We have conducted Facebook Live events for our staff in the county, and that was done by Susan Holt. And then on Monday, a Facebook Live was conducted by Susan for the general public in English. And what those Facebook Lives have been about is how can we manage our own emotional health and support those around us. They've been very well received. One in Spanish was done by Galera Castro yesterday, and that's available on Facebook. And one today was done in Hmong by Dr. Gia Zhang of the Fresno Center, and so that also is available on Facebook. We're definitely seeing that while we may not have a large volume of people watching it live, we're getting quite a bit of views afterwards. So please feel free to share that. It has some really helpful information, and even for all of us. And so I recommend that. I'll go over our homeless efforts in a minute. Just a reminder again to stay home if you are sick. And if you are coming to work and you develop symptoms while at work, go home immediately and call your supervisor. We are continuing to send out daily mental health recommendations via email, social media, web pages, and the general media. And so I'm going to play right now a video that is coming out from our department, just reminding people about the public health recommendations. And I'm looking at Brian to see. It'll take just a second. Here we go.
Think it's working? It'll, yeah. It's a little delayed.
It's a little delayed, yeah. I see it now, yeah. Okay. All right, so that's our latest video that will be going out through all of those media options that I mentioned. In terms of our homeless outreach efforts, we now have around 300 individuals who are homeless housed in shelters. We are isolating individuals who have been tested for COVID and who are homeless. And keeping them under the isolation recommendations and precautions that public health has recommended, which is essentially for everyone's benefit. If you are diagnosed with COVID or develop COVID-like symptoms, we really want you to be isolated for at least 7 days from the time you first develop symptoms or are tested, and 3 days after those symptoms end. So that might be within that 7-day window, but it might also be beyond. So let's say you were sick and you want to go at least 7 days, but you remain sick for 10 days, then you wouldn't come off of isolation until 13 days after your first symptoms. If you have any questions about that, please contact us and we'll share that with you. We are also looking at using some hotels for additional shelters as we identify homeless individuals who are willing to be sheltered. And we're looking at the trailers that have been made available to the city of Fresno through the state, and continue to support all of our existing shelters. Right now, I'm going to take any questions you might have about any of the topics I've discussed today or anything that you are concerned about. I will say that we are going to have an opportunity next week specifically for our contracted partners to answer some very specific questions that a number of you have raised to me in regards to how do we care for our clients during this time, what resources might be available to sustain or maintain operations, and what kind of guidance or waivers are the state giving us. I have sent out quite a bit of information via email, but we thought having a question and answer session and giving you the opportunity to ask specific questions would help to get those questions answered appropriately. So
Maybe a bit of a delay.
we have a bit of a delay between the actual in-studio video and YouTube, so we're going to give it a couple more minutes to see if we have any questions. If we end up not having questions or you don't get a chance to ask your question during this session, as usual, we will ask you to feel free to contact me or an analyst or your supervisor, anyone in our department with your question, and we will do our very best to get that question answered. We're still not having questions, so we'll give it another 30 seconds or so. I will reiterate that I know that this is an incredibly emotionally challenging time for all of you. I know it has been for me. What we are going through as a nation, as a state, as a county, as a community, and within our own families is unprecedented. It is, there's so many unknowns, and there are things that are changing each and every day. Sometimes questions getting answered, and sometimes new questions being raised. We really highly encourage all of you to develop just a few trusted resources for news. We're really recommending that you don't overindulge in research and news and such. It tends to not be good for your mental health, and we strongly encourage you to watch one of the videos that have been produced that give you lots and lots of tips of how to manage that. So we have our first question.
What information do we have on testing?
Okay. What information do we have on testing? What I can tell you about testing is there are a few ways that people are getting tested. People who present to a hospital with COVID symptoms might be identified as someone who should be tested, but not necessarily, depending on what that hospital's criteria are, and that's typically based on the severity of symptoms, whether or not you're going to need to be admitted, and the capacity that the hospital has in terms of having tests available. So that's one way. Some private physicians also have some test kits available, and they are using primarily commercial labs at this point. I think both Quest and Core are doing that. Through the public health department, they are also conducting some testing, but that is by appointment based, again, on symptoms, and priority is being given to frontline healthcare workers who may have been exposed or first responders. We are, frankly, still in a situation where while we do have some capacity to do testing, it's limited, not just in case of the tests themselves, but also the tools and the resources needed to conduct the testing. And that includes everything from equipment to reagents and the different substrates and such that labs use to do the testing.
Do flu shots help?
There was a question of whether flu shots help. I am 100% not the expert to answer that question. But I would tell you that we do know the coronavirus is not a flu virus. So what I have heard, and I would encourage you to look at the public health website, is the one way a flu vaccine could help is simply to keep you healthy from the flu. We know that for individuals who have a compromised medical condition, COVID can have more significant impact on you, and so we wouldn't want you to get the flu and COVID. There was a question about the projections for infections for Fresno County. I have not seen specific county level projections at this time, other than to say we highly anticipate the number of infections to increase. Within California, we're one of the counties that enacted some of the public health measures sooner rather than later. We are hopeful that that will flatten our curve, which just means our pace of new infections will slow down or be not as quick as some other parts of the country and the world. But I personally don't have those. As they become available, I will certainly share those.
Can we expect evaluations and potential pay increases to happen on schedule, or will they be delayed? If they are delayed, will that affect the date of any pay increases?
Okay. There was a question about evaluations, performance or personnel evaluations, and whether those would continue to happen on time, and whether or not any pay increases associated with that would happen on time, and if they were delayed, would the pay increase be delayed? It's my understanding at this point that as much as possible, we'll continue with that routine aspect, and that just as in the past, if there was a timeline that you were qualified or eligible to have a pay increase, that would be adhered to even if for whatever reason it was done retroactively. I would ask for all of your patience. I'm sure you can appreciate that right now a lot of our staff's resources are going toward responding to this crisis, and we are doing our very best not to let our routine work fall behind, but I trust you will understand if there are some delays.
Some heard that geographic information on where confirmed cases will be available, such as at the city level. Is there any update?
Okay. There was a question about whether or not geographic information would be available regarding COVID cases who have been confirmed positive in our community. I cannot emphasize enough this next point. You should presume wherever you live in Fresno County that you have COVID cases. You should not look to that data to inform anything about how you conduct your day-to-day activities. They should be cautious, and you should adhere to the stay-at-home orders. And if you become symptomatic or ill, you should isolate yourself. I know there's a lot of curiosity and fear and desire. What I can tell you is from what I've been told, and I have not been told specific locations, but I've been told there is no part of our county where there are not cases, essentially. And so you should operate under the assumption that if there are not confirmed cases in your area, it's only because they haven't been confirmed yet. And again, we need to normalize for ourselves that COVID is here and it will be present in our community for some time to come. We don't have any more questions, so we will conclude this session today. The PowerPoint reminds you those trusted resources that we recommend, our own Fresno County Department of Public Health. And each day by about 5 o'clock, they update their website to let you know about the current cases in Fresno County. We also have the state's Department of Public Health, the CDC, and the World Health Organization. Oh, one more question came in, a late question.
When this is resolved and we're able to return to work, what is going to be policy change of those coming to work sick? Will we be able to work from home in the future if we're feeling ill?
Okay. The question is, when this is over, will there be any policy changes about individuals coming to work sick? I do not have a crystal ball, but what I can predict for you is that I hope all of us have a heightened sense of the inappropriateness of coming to work with any illness, particularly an infectious or contagious illness. And so while I'm not sure about a policy change, I'm going to encourage you today to never come to work sick again, regardless of whether it's COVID or anything else that you could possibly give to another person.
Is immunity gained after having COVID?
There's a question about whether immunity is gained after having COVID. There is a tremendous amount that we do not know about COVID. Most viruses, it is believed, an individual who's been exposed has immunity for some period of time. But we do not know right now with COVID what that is, whether or not there is immunity, and whether that immunity is conferred for what period of time. And so as that information becomes available, we will be happy to share that with you. Again, I would encourage you to seek those trusted resources where that type of information would come sooner rather than later. Okay. Because we have a delay, we're allowing for one more question. Yes?
Will work from home be an option in the future after COVID-19?
Oh, this is a good question. I think we had a question like this last time. Will work from home be allowed after COVID-19? Well, I tell you, if there's any silver linings to this, I hope it helps us understand both what work can be productively and effectively done at home, and what resources do we need to ensure that staff are able to do that type of work at home. So yes, I do anticipate and hope that through this process we learn and we have the opportunity to understand better ways of doing our work, and also understand how our clients prefer to receive services. And so we will be hoping to learn from this. I apologize for the slight delays, but because of the time delay in the filming and it showing up on YouTube, we just want to give a little bit of time for people to ask questions and get them answered. Well, I'll try one more time to tell you how much I appreciate all of the work that all of you are doing. Please know that those of us in leadership roles in the department are working very hard to protect our staff, our clients, the people we serve, and our community. And I know our contracted partners are doing the same. And on behalf of myself, the leadership team, and the Behavioral Health Board, we want to thank you. And we will get through this. There is a lot of unknown in our future, and that's hard. But if we stick together, and as we say, stand apart and work together, we will get through this. And I appreciate all of you for making my job a little bit easier. Thank you.